Shifting focus, Congo has announced 11 new confirmed cases of Ebola and 2 deaths amid an outbreak. The World Health Organization has called an emergency meeting to discuss the Ebola outbreak and its response. The WHO confirmed that the new case has come up in Vanganta, a city of nearly 1.2 million people in northwestern DRC. The spread of the virus from rural areas into a city has raised fears it could quickly spread and become difficult to control. Until now, the cases and deaths were reported from the rural Bikoro health zone, allowing authorities to attempt ring fencing vaccinations in the affected areas. Now, WHO says a newly confirmed case in a densely populated part of the country will complicate attempts to control the outbreak.
If we see a town of that size infected with Ebola, then we're going to have a major urban outbreak, which is going to be a real challenge in order to respond. As we saw in Ebola West Africa, once Ebola gets into urban areas, especially poor urban slums, it's extremely difficult to get rid of the disease, much more difficult than in isolated rural areas.
And the first batch of 4,000 experimental Ebola vaccines to combat an outbreak arrived in Congo's capital, Kinshasa, on Wednesday. The vaccination would start at the weekend, the first time the vaccine would come into use since it was developed 2 years ago. The vaccine is still not licensed, but proved effective during limited trials in West Africa in the biggest ever outbreak of Ebola. Ebola had killed 11,300 people in Guinea, Liberia and Sierra Leone between 2014 and 2016.